ACL is the main stabilizing ligament in your knee, and basically it functions in anterior translation, meaning front to back, and also some rotational stability of the knee. And this is one of the main stabilizing ligaments that you see. Particularly you see it with contact sports where you got a lot of injuries, whether it's a non-contact pivoting injury, which is very common, or you can have a direct trauma to the knee where typically the foot is planted and there's a direct blow to the knee. And so most of the times it can be obvious, and other times it can be somewhat harder to kind of determine. But there can be a clinical diagnosis where we do a good physical examination and kind of take a look at the knee and see the stability of the knee. There's a few exam maneuvers that we would focus in on. We typically start with some radiographs or some x-rays, and a lot of times we'll get an MRI to kind of confirm the diagnosis and take a look and see if there's other soft tissue injuries, whether it be to the cartilage surface or the meniscus. Once the ACL is torn, it's typically a ligament that doesn't have good healing potential. And so in a young active population and people who pivot and require change of direction, it's something that we would reconstruct. It doesn't have great healing potential a lot of the time, and so instead of repairing it, which is an option for some patients, most of the time we end up reconstructing it or making a new one. With surgery, it's basically we go in and take out the remnant stump of the ACL that's there, and we recreate a new one. That can be either done with autograft, which is tissue from somewhere else in your body, or you can use donor tissue from an allograft or a cadaver tendon to function as a new ACL. The autograft can be taken from typically a piece of a bone from the patella and the patellar tendon. You can take it from some of the hamstring tendons there, or a quadriceps tendon can also be utilized, and that's one of the newer techniques that has some very good outcomes as well. So recovery for an ACL, you're looking at quite a bit of downtime. And so you're looking at first regaining motion of the knee and then getting some of the swelling out of the knee. There tends to be definitely some stiffness afterwards, definitely some muscle atrophy. And so the rehab process is pretty important. All said and done, the earliest athletes can kind of get back out to play is 6 months after the injury. And that's, assuming things go exactly, according to plan. But for most athletes, it's 9 months to a year before they're back out to the pivoting sports. And so in young athletic population, most of the time you get back to the same sport, typically at the same level. The other thing I guess to consider would be the other injuries that can occur with the ACL. And so a lot of times you'll see a meniscal injury involved with that, and that can sometimes dictate the recovery as well. If the meniscus is torn and we are able to repair it, and that's the ultimate goal, then typically you need to be non-weight bearing for up to 6 weeks afterwards. And if there's other ligaments involved, sometimes the rehab is a little bit longer to get back to what patients like doing. Yeah, and so the recovery is a little bit quicker in that regard. Younger patients tend to have better healing potential, and so with partial tears, sometimes they can be repaired, or if the ACL is actually torn off of its origin, a lot of times it has good healing potential, and putting some sutures through it and anchoring it back up to the bone is a good treatment option for those patients.